From baggage claim to pajamas in 10 minutes. Erie International Airport. Fly with ERI.com.
Fly Erie International Airport to Charlotte on American Airlines, your nonstop gateway to the world. Also, we have Breeze Airways flying nonstop to Orlando and Tampa, Florida. A great low-cost carrier providing excellent service to the regional community. Fly Erie International for your travel needs.
Fly with ERI.com.
All year round, Frontier Home Products and Design has what you need to make your home comfortable and beautiful. Relax on a new timber tech deck designed by Frontier's experts. A new fireplace from Frontier Home Products Fireplace Gallery adds warmth and serenity to any home. Beauty and versatility at Frontier Home Products and Design Center, 4213 Peachtree, East 5th, next to the Bayfront Highway.
Frontier Home Products and Design Center. Discover a new frontier.
PA contractor number PA 039007.
Welcome to TalkErie.com's Joel Natale Show, Erie, Pennsylvania's daily podcast. Every day, we tackle the biggest issues that the Erie, PA region faces. Stay informed and involved as we advance the narrative of Erie. Now, here's Joel Natale.
I have with us Dr. Jeffrey McGovern from AHN St. Vincent. How are you, sir? Appreciate you being on.
Yeah, thanks for having me, Joel. Appreciate that.
Sorry about the mix-up with the link, but we're here. We want to find out about sleep apnea, and let's start with the basics. How prevalent is this diagnosis, and maybe are there several diagnoses of sleep apnea or these types of conditions?
Yeah, so and answer your question about prevalence, generally speaking, we're seeing actually just the tip of the iceberg. Many people who have sleep apnea don't come in to see their physician or their provider until they're symptomatic. So there is typically sleep apnea that can occur with symptoms, but mostly without symptoms. And it's only to the point where after months to years, people have symptoms that they'll explore it. But it can take some time because people think it's related to, a poor bed, or maybe their children are waking them up, or other things that they explore. And sometimes it can take about a year or two before they realize that they really need to get to be evaluated. But bottom line is that anytime there's excessive sleepiness, sleepiness during the day, and it's persistent despite sleeping adequately during the night, it's got to be evaluated. It's not necessarily related to external measures or external features. So that's important. So the tip of the iceberg we're seeing. Generally speaking, the great study that was performed years ago called the Wisconsin cohort looked at men and women with sleep apnea. And generally speaking, it's anywhere from 5 to 10% of men and women, more men than women, in the middle ages, and that it increases as we get older. So 5 to 10% of people, generally speaking, is a pretty big number.
Sure. And
when you compare it to other kind of disease states. So very, very common that we see this.
Is there different chronic levels of this, or and I would be interested in knowing what the symptoms are, because does it take somebody from out, like a partner, to say, hey, I think you need to get this checked out because you stopped breathing for 40 seconds or whatever it was,
These are great questions. So getting back to the original question, are there different kinds of sleep apnea? Yes, there are. The most common is obstructive sleep apnea. And obstructive, it really means what it says. It means that the airway is closing up. And so in deep sleep, what happens, the musculature, because of the construction of the airway, as we go deeper and deeper into sleep, that will close up on us. And that gets to the point where we have difficulty breathing during the night.
And what, Doc, what's closing that? Is that the tongue?
Yeah, so a lot of things are happening. So it can be the tongue falling into the airway. It can be just, again, the way our airway is constructed. I always tell my patients, think of your airway like a tube. Mm-hmm. And that tube can be a patent tube, it can be wide open, or it can be a smaller tube with little kinks in it. And that's kind of what happens with our upper airway. these are the airways that we inherit, but they could also be airways that can be affected because of, reflux can make the airway affected. Tumors can make the airway smaller. Goiters from thyroid can make the airway smaller. So there's a lot of things that we inherit and a lot of the things that we pick up along the way that can affect the airway. So that's obstructive sleep apnea. A more rare instance is central sleep apnea. And I always like to think and talk to my patients about central sleep apnea involves the spark plugs. So the spark plugs being the brain.
Yeah.
The brain is a very important actor in terms of sleep, but sometimes what can affect sleep apnea is the spark plugs not working, where there is not an urge to sleep. There is not a tendency to keep the airway open, so that basically the brain tells you to stop breathing. And those are different ways to treat those as well. Fortunately, that's a lot more rare. Yeah. We see that in a lot more people with strokes, in different parts of the brain that could affect the breathing centers. And there's different, more specific ways to treat that. So fortunately, the lion's share of people with sleep apnea have obstructive. The third category is, as expected, a mixture of the two. Okay. And we call that mixed sleep apnea. Some central sleep apnea, some obstructive sleep apnea. So that's kind of three categories: obstructive, central, and central sleep apnea. You talked also about, how does this come to be evaluated? Well, you mentioned the bed partner is really key because generally speaking, we don't know if we snore. We don't know if we have sleep apnea. When we're asleep, it's the bed partner that can make a big difference. So the stories I get when people come into my office, it's like, I sleep alone, but I shared a hotel room with such and such, and they stayed up all night because I snored, and they noticed that I stopped breathing. That's kind of the classic scenario. Sometimes we can actually have episodes where we're snorting ourselves awake when we're lying down, or we have episodes where we think we're like drowning. A classic case I have of many patients, they have recurrent dreams of that someone's smothering them with a pillow, or someone's they feel like they're drowning because they really are, and dreaming is really reflecting what actually is going on. But those are less common events that you'll see, but mostly it's the bedmate saying, or the partner, or the hotel room person is telling them that they're having problems with sleep.
All right, so walk us through what so the patient's presenting. What is the clinician's kind of basic toolbox to just really try to find out what the heck's going on with this guy?
That toolbox may be something that's a small toolbox or a big toolbox. As a sleep specialist, I've got a big toolbox. What I do actively in teaching med students and residents and other doctors, I give them tools or arrows for their quiver, asking a question. So I ask them, from that perspective, ask about snoring. It takes 2 seconds to ask about snoring. If they're snoring, is there any sleepiness? So those are two really important questions to ask and starting the discussion about sleep and sleep apnea. Very important.
What about staying asleep, though? Could that be an indicator of sleep apnea? I'm asking for a friend.
Sure. It's I see where we're going here. Okay.
Well, because I've had a classic. Not to make it about me, but my classic MO is if I'm under stress, I see 3 o'clock every night.
Get paid to drive. Start a new career behind the wheel at the EMTA. If you are looking for a high-paying and rewarding career with full benefits and paid training, stop by or apply online today with the EMTA. Plus, EMTA riders can now enjoy free Wi-Fi on new, clean, and environmentally friendly buses to travel all over Erie County. Visit ridethee.com for more information.
Get on board EMTA. Get on board EMTA.
Quickfill gasoline is made right here in America. United Refining Company, who operates Quickfill, refines its gasoline from North American crude oil in Warren, Pennsylvania. When you buy United Refining Company gasoline at Quickfill, you keep jobs and businesses in America, and you keep American families strong. You don't need to send your money overseas when you buy gasoline. Buy American-made gasoline at Quick Fill. Quick Fill, driving America.
You know what I mean?
Sure. And that's the important thing. And that gets to what I do as a specialist. I'm able to get, I've got admittedly a lot more arrows in my quiver to work with. And so these are things that you really explore. So the screening is, are you snoring or are you sleepy? Those are simple questions to ask that a med student can ask, a resident can ask, and that can be in the daily kind of, evaluation of a patient coming in for a sore throat or a cough or a routine evaluation. Because quite honestly, people bury those things, or they get nervous going to a doctor, and they don't volunteer that stuff. So screening for those things are important, and then maybe exploring them basic on their comfort level, or even referring them to someone like me makes a difference, and I can go a little deeper. Yeah. So I can tease out whether the sleepiness is related to stress or the sleepiness is pathologic, related to a sleep disorder like sleep apnea or narcolepsy or those kinds of things. So it just takes the highlighting of it to be to make sure that you can actually work it up appropriately. Because stress affects sleep. You have trouble getting to sleep. You have trouble staying asleep, and those are important things. But unless we're dealing with a daily ongoing stress, you should not have any sleepiness. You should not. There should be some window of improvement with sleep apnea and all the other pathologic diagnoses of sleep. These things don't improve. That's the difference.
Let me ask you about these folks are wearing these watches. They might wear a Fitbit. They might wear an Apple Watch.
Yeah,
and it can measure levels of sleep. Are there any real data points on a watch that could prompt a patient to say, "Hey, I better go get this checked out"?
So the easy answer is usually not.
Okay.
The wearables, as we talk about, they're called oscillometers, which basically measure your movement. So what this watch is saying is that, okay, this person isn't moving, so they probably are sleeping. They're not moving at all, so they're probably in deep sleep. So they're really proxies. They really don't measure too well. Now, there are some wearables coming out which are FDA cleared, which can be helpful for screening for sleep apnea, or checking your oxygen. So these are not the ones that you'll buy, at a big box store or anything like that. These are ones that are pretty costly and FDA cleared for that. But again, it's really a poor proxy, but a proxy nonetheless. So, and I'll add to that too, as you mentioned, that as soon as we want to study these wearables, the generation changes.
Yeah.
So by the time we get papers out and studies out, it's on the second generation, when maybe the fourth or fifth generation is out. So it's hard to correlate a specific wearable, is what we're saying.
We're talking to Dr. Jeffrey McGovern. He is an AHN St. Vincent pulmonologist, and we're talking about sleep apnea. All right, so we've got the maybe the referral from the PCP, or they're self-presenting. What do you do? Do you immediately order a sleep study, or what's the next step, I guess?
Yeah, a great question. So these are you want to. First thing is to do, we're not test crazy. You want to sit down and talk with a patient. Get an idea if there's something that's real going on, or as you mentioned, is it maybe some stress related issues that are going on, and those are important things. What I like to emphasize is you're taking care of the whole patient, making sure their medical problems are in tow. They're making sure their medications aren't causing problems, and that's an ongoing issue which you have to address. So, looking at the medical history, looking at the medication, taking a good sleep questionnaire, doing a diary if you can too, finding out what time they go to and what time they sleep. There's a great study that came out of London about 10 years ago, and which looked at the sleeping habits of Londoners. And this interesting study, which kind of reflects on what goes on to this present day, basically categorized that the people in London essentially slept 6 days or 6 nights of the week. Now, do the math on that. Basically, they're missing an entire night of sleep. So that's what we call insufficient sleep syndrome. That's one of the most common disorders of sleep, is that we're not getting enough sleep. So sometimes it's just as easy of looking at their sleep diary and talking about sleep and really sorting through and fixing things without having to do any testing. So that's important. So if there is any evidence or concern for sleep apnea or narcolepsy or other 110 other sleep disorders, then a sleep study is definitely appropriate.
So after the study, the current kind of standard, standard indication would be, let's get this person a CPAP, right? What exactly does a CPAP do? Because it's going to lead us into this new tech,
Sure. So again, if we diagnose sleep apnea, there's different categories: it mild, moderate, to severe. And I tell my patients always, there's other things besides CPAP, right? CPAP is like a pressure stent. So basically, it provides not oxygen, but a pressure which prevents collapse of the airway. Remember, we talked about that tube. Right. The tube is smaller. The tube is kinked. And so what that pressure does is that straightens out that tube, and it makes it patent. So people don't have low oxygen episodes. They're not waking up during the nighttime. And everyone, has a different pressure, of course, that requires. So it's very effective. But there's other treatment options. But the CPAP is more effective because it's easy to get. It's easily covered by insurance. So it's a really quick way to treat sleep apnea. But again, there are other ways to skin a cat, clearly.
So this new tech, this Inspire implant, I'm like, well, how would an implant, take the place of, what you say is like a positive pressure tube? Tell me about it.
Okay, sure. But before we kind of talk about that, express some. So I talked about other options. CPAP, as I mentioned, is a common issue we treat, but oral appliances are quite nice too. Oral appliances are little devices made by dentists which help to pull your jaw forward. We've got a great dentist who has been working with us for over a decade. So that's typically for mild sleep apnea for the most part, but sometimes moderate. CPAP is really good for those who are really symptomatic, who need a real quick fix, who have moderate to severe sleep apnea. There's other devices we wear in your nose, which is like a mini CPAP without the wires and the tubes. There's ways to strengthen your tongue, which prevents it from falling back into your airway. Some of the simple things, too, are positional therapy. Sometimes we find out in doing sleep studies that when patients sleep on their left or the right and they're off their back, lo and behold, there's no significant sleep apnea. So doing positional therapy is quite nice, too. So we used to have some kind of sort of not to be ribald, but we used to have ways where we used to have people wear bras in their back. And the bras would be filling with like tennis balls or things like that. And that would prevent them from rolling on their back. There's a lot more technical ways to do this. And quite honestly, very simple ways. So we can actually make a difference just by getting some information. But what you're talking about, Inspire, Inspire is a neat technique. Admittedly, it's not for everyone. It involves 2 surgical procedures, but it's for people with moderate to severe disease who really can't tolerate any other modality. So I like to think of it as really a game changer, a life-saving device. How it works is very simple. It's like a generator, which is inserted into the chest, anterior chest, and there's 2 wires. One wire goes to the tongue. The other wire goes to the diaphragm, and the diaphragm wire senses breathing, so it tells you when you're taking a breath in or breathing out. And the wire that goes to the tongue applies a voltage. Now, before we get ideas that we're like Frankensonian here, it actually is turned on at nighttime and turned off during the day.
Okay.
And this is something that patients accommodate to. They basically increase the level of voltage where it's effective and tolerated. But what that voltage does in the tongue is it stiffens the tongue so it doesn't become lax and fall into the airway. We talked about things that can obstruct the airway. The tongue is a major part of obstructing the airway. So that's how it works.
Again, I'm thinking about all these new ways. You know, we heard about how you could stimulate the kidney in order to bring down hypertension. I mean, this is a new world that we're living in, isn't it?
It's cool stuff. It really is cool stuff. And the main thing it does is it gives folks other options. Yeah. It really does. And that, you know, we're not cookie cutters, and it's very satisfying when I can sit down with patients and they say, "Well, I don't want CPAP. I have claustrophobia, or I tried and it didn't work." And you know, the worst thing is for people to give up because they don't think of any of their options, and there are other options. So again, you know, a lot of options. You know, Inspire maybe for some people, not for other people. CPAP, etc. So, yeah, the fact that we have options is wonderful. It makes what I do a lot more satisfying, a lot more fun to treat patients.
My understanding is that you're going to have a seminar coming up here to talk about this technology. Can you give us some details on that?
Yeah, sure. So that's going to be on November 9th. And the reason which I wanted to do it is because admittedly, you know, the commercials that come out, you see these well-groomed people and these people with CPAP not looking so well-groomed, and it sort of gives the impression that Inspire is for everyone. And admittedly, it's not. I think it's a life-changing technique, but quite honestly, it's not. So I want to talk about some of the myths about it, but I also want to talk about the effectiveness. And I just really want to answer the questions which these darn commercials really aren't answering. Because I can tell you, it comes up very often when I see folks. So I've done these talks about sleep apnea, about sleep issues in my 20 plus years that I've been here, you know, speaking at different localities. So this is just another way of reaching out and just giving patients information. What's kind of neat, we're actually, one of my patients who has the Inspire agreed to give some testimony as well. She'll also tell you that it's not for everyone. She'll talk about some of the pitfalls and all that, the real things. So it's very gracious that she's speaking about this. So it's a short event. It's going to be at the Erie Public Library on November 19th at 6:30. So a Tuesday, November 19th at 6:30 at the Erie Public Library. So just really informative things I've been doing all through the years. Is just another way of reaching out to folks.
We've got to leave it there. Dr. Jeffrey McGovern, the AHN St. Vincent pulmonologist, talking about sleep apnea. You know, if you don't have your sleep, you don't really have good health. And so this is such a hugely important issue, isn't it, Doc?
It is. Thank you very much for reaching out about this. I appreciate that.
You've been listening to The Joel Natale Show, Erie, Pennsylvania's daily podcast from TalkErie.com. Subscribe to our show on your favorite podcatcher and get involved by emailing joel@talkerie.com.